Good day everyone, my name is Ronald James Giboni from BSN 11B. And for today, I will be performing a return demonstration for cardiovascular system. Okay? So to start for the pre-inductory phase, first is we review the client's medical record if available. So check for doctor's order for the need to perform the assessment. So this is to gather information for the client's health history. Next is to determine the scope of the assessment and prepare the necessary equipment. So this is to conserve time and energy. So the materials we will be using for our assessment is the stethoscope, a ruler, and a rectangular card, and a pen light. Since I don't have a pen light, I'll be using a lighter with a light. And lastly is perform hand hygiene to prevent from spreading a microorganism. So to start our introductory phase, first is we greet our clients politely, then introduce ourselves, then verify client's identity and how he or she would like to be called during our assessment. This is to establish report. So good morning, sir.
Morning, sir.
My name is Ronald James Giboni, your student nurse for today. So may I ask for your name, your age, and your birthday?
My name is Jasper Uyao,
Okay.
20 years old,
Okay.
born on August 23, 2001.
Okay, thank you, sir. How would you like to be called during our assessment?
Jasper, sir.
Okay, thank you, sir, Jasper. So next is explain the procedure and how he or she would be participating during our assessment, and ask if he wants to raise questions, concern, and any clarifications. So for today, sir, we will be having an assessment to your cardiovascular system. So I'll be listening your pulse. So I'll be auscultating your neck, your arms, and your legs. So is that okay for you?
Yes, sir.
So do you have any clarifications, concerns, questions before we begin our assessment?
No, sir.
Okay. So next is ensure client's privacy, confidentiality, and comfort. So sir, before we start our assessment, so can I close the door?
Yes, sir.
Okay. So do you how about our room temperature? Is it okay for you, sir?
Yes, sir.
Okay, thank you. So next is inquire if client has any existing cardiovascular system. Cardiovascular problems, health history about cardiovascular. So, sir, before we start our assessment, so I have questions here. So, do you have any history of cardiovascular diseases, problems?
None, sir.
Do you have any chest pain that could involve your heart or lungs?
None, sir.
Okay, so what are your hobbies, exercises, your daily routine?
Farming, sir.
Okay, so what are your plans?
Eggplant, sir.
Okay, thank you. Thank you, Sir Jasper. So to start for the working phase, first is we stand at the right side of the client and position the client supine with the head of the bed elevated between 30 and 45 degrees, making sure that the head and torso are on the same plane. So, take a bath. Tingin mo pa sa ugat. So to start for the working phase, first is we stand at the right side of the client and position the client supine with the head of the bed elevated between 30 and 45 degrees, making sure that the head and torso are on the same plane. So this is to prevent any nerve damage and to prevent from any unnecessary extension. So since we are home based, I'm just putting pillow at the head part of the client so that the head of the client is elevated between 30 and 45 degrees. So next is instruct the client to turn the head slightly to the left and show tangential light source onto the neck, suprasternal notch, and area around the clavicle. This is to observe any pulsation and shadow. So, sir, may I ask if it's okay if you turn your head slightly to the left? Okay, sir, thank you. So, I'm gonna show light. Okay, thank you, sir. If jugular distension was noted, assess the jugular venous pressure by locating the highest visible point of distension of the internal jugular vein. This is to differentiate the different form of heart and lung disease. So, as deemed necessary, raise or lower the bed until the highest visible point of distension of the internal jugular vein is observed. This is to indicate right side heart failure. So next is we measure the vertical distance in centimeter above the sternal angle by extending a long rectangular cord horizontally. Okay. I'll be measuring, sir. Is it okay? So can you turn your head slightly to the left? Okay. Sir. Next is repeat the procedure on the other side. Can you move your head? Can you turn your head slightly to the right? Thank you, sir. Next is position the client's head slightly toward the side being examined, then palpate the carotid artery cautiously, avoiding too much pressure or massaging the area. This is to distinguish types of valvular heart disease. So I'll be palpating your carotid area, sir. Then repeat the procedure on the other side. Okay, thank you. Turn the client's head slightly away from the side being examined. So place the bell of the stethoscope over the carotid area, then ask the client to hold his or her breath for a moment and auscultate the carotid artery and listen for bruit. This is to determine if there are any bruit noises. So, sir, I'll be auscultating your carotid area. Can you turn your head? Okay, sir. Can you hold your breath, sir? So, next is repeat the procedure on the other side. So, can you move your head, sir? Slightly. Okay. Hold your head for a while. So now we begin with general inspection of the chest wall. So stand at the right side of the client with the head of the bed elevated at 30 degrees and look for any abnormal pulsation. So show a tangential light across the chest wall over the cardiac apex to make this movement more visible. This is to detect any abnormal pulsation. So I'll be inspecting for your chest wall, sir. Is it okay?
Yes, sir.
Okay. So since there's no any abnormal pulsation, so let's proceed to the other. Simultaneously inspect the precardium for pulsation while palpating the aortic area, pulmonic area, tricuspid area, and the apical area. So first is palpate for hips and lifts using the palm and hold finger pads flat or obliquely against the chest. So sir, I'll be palpating your chest. Is it okay for you?
Yes, sir.
Okay. Okay. Next is for trills. Press the ball of the hand firmly on the chest to check for a buzzing or vibration sensation caused by underlying turbulent flow. Okay, sir. Then next is palpate impulses using finger pads flatly or obliquely on the body surface from the aortic area, pulmonic area, and tricuspid area. Okay. Next is palpate the apical impulse using the palmar surface of 2 to 3 middle finger. Then for finer assessment, palpate with one finger alone to confirm characteristic of the apical impulse, noting for location. So, if unable to palpate the apical impulse with the patient supine, reposition the patient to roll partly onto the left lateral side. So, sir, can you roll to the left side in order to palpate your apical impulse? Okay. Okay. Take off your position. Okay, thank you, sir. So next is palpate and inspect the epigastrial area at the base of the sternum and abnormal aortic pulsation. Okay, thank you. Next is auscultating. So first is assess for heart rates and rhythm by placing the diaphragm of the stethoscope at the apex and listening closely to the rate and rhythm of the apical impulse. Counted the heartbeats for a full minute. So this is to detect for any irregular rhythms. So I'll auscultating your chest. So, using the diaphragm of the stethoscope first, then the bell auscultate the heart in all four anatomic sites. So, we have the aortic, pulmonic, tricuspid, and apical areas. For heart sound, extra heart sound, and murmurs, ask the client to breathe regularly while auscultating. So, sir, I'm gonna auscultate your heart area. Just breathe normally. Okay, thank you, sir. Then repeat the procedure step while patient is in left lateral position, then at sitting position, leaning forward, and briefly stop breathing after exhalation. So, sir, I'll be asking I'll be asking you to roll from the left and sit and lean forward. Is it okay, sir?
Yes, sir.
Okay. Can you sit? Sir? Inhale. Exhale. Hold your breath. Exhale. Okay, sit. Can go back to lie down, sir. Okay, thank you, sir. Assess each arm for size, symmetry, skin color, and temperature for from fingertips to shoulder. This is to determine for any edema, lesions, changes in skin texture, and hair distribution. So, I see your arms. Thank you. Now inspect the peripheral veins in the arms for the presence and appearance of superficial veins when limbs are dependent and when limbs are elevated. Arms. Palpate for radial pulse, ulnar pulse, and brachial pulse individually and bilateral. So, sir, I'll be palpating for your pulse. The next is assess for capillary refill. This is to monitor dehydration and the amount of blood flow to tissue. Sir? Okay, thank you, sir. Next is perform the Allen test. So, sir, if I see close your hand, just close your hand, then if you I'll say open, then open your hands. Okay?
Yes, sir.
So Can you do close and open your hands for 5 times rapidly? So start. Then squeeze it, close it. Okay. Then release it. Okay. I want you to do it once again, 5 times. So start. And squeeze it. Then release. Okay, release it. So repeat the procedure on the other arms. So, be checking for your pulse. Sir. Then just do it what we did on the other hand. So start, open and closing your hands. Squeeze it. Okay, release. Now do it once again. Go. Now release. Okay, release. At supine position, assess each leg for size, symmetry, skin color, and temperature from groin to toes. So this is to determine any lesions, changes in skin, texture, and distribution, and hair distribution. Okay. So sir, can I check for your legs?
Yes, sir.
Okay, thank you, sir. So next is inspect the peripheral veins in the leg for the presence and appearance of superficial veins when limbs are depending and when limbs are elevated. So, okay. So next is palpate for femoral pulse, popliteal pulse, dorsalis pedis, and posterior tibialis tibialis individually and bilaterally. So, sir, I'll be checking for your popliteal pulse. Okay. Thank you, sir. Next is assess the peripheral leg veins for signs of ulcerations, varicosities, and thrombophlebitis. So inspect the calf for ulceration, varicosities, redness, and swelling over vein sites. So sir, I'll be inspecting for your legs. Is it okay? Okay, thank you sir. So next is palpate the calves for firmness or tension of the muscle. The presence of edema over the dorsum of the foot and areas of localized warmth. Push the calves from the side to side to test for tenderness. So, just relax your legs, sir. I'll be pushing for your calves. Okay. So next is firmly dorsiflex the client's foot while supporting the entire leg in extension or had the client stand or walk. So, sir, can you stand up for a while? Okay, sir, thank you. Goodbye. So, next is assess for capillary refill for both legs and repeat the procedure on the other leg. So, lastly is inform the client that the assessment is already done. So sir, thank you for participating with me. So our assessment is already done. So next is summarize the information obtained during the working phase and discuss the findings to the client. Discuss to the client the possible plans to resolve the health concern if present. So sir, these are the data that I have gathered during our assessment. So my finding is that your pulses are fine. When I auscultate the part of your lungs, your heart, there are no grooviness. The rhythm of your pulse is normal, and there are no edema lesions in your skin. Your capillary refill is normal. Your blood is normal. Your cardiovascularity is normal. So just maintain your exercise with your cardiovascular system, and always don't forget to eat healthy lives, have a healthy living, and keep yourself from hydration. Just drink a lot of water. Then thank the client for his cooperation and end the assessment politely. So, sir, once again, thank you for participating with me in the assessment. So, just don't hesitate to come back if you have any problems, so that I will be assessing you again for another time. So, thank you, sir.